All right, welcome everybody on a Wednesday night. I want to give a little background to this webinar. I flew all the way to Austin, Texas for this webinar. I've been traveling all day. I left Idaho this morning about 4:30, drove 3 hours to Salt Lake City, got in the airport, got actually registered for TSA this morning. I travel so much and have for years, but for whatever reason, haven't done TSA, so I got that done. Flew to Austin. It's already a fun vibe here. I've never been here before. And then here I am at a Hyatt Regency in Austin, Texas. And so excited to be here with you. I hope this all comes off well. All right, I want to share my slides or look at, this is a little different. I'm used to having two screens. All right. If you are listening, you can't see this anyway. If you're watching, then I hope my voice correlates with the slides. But again, I want to give a little background to this webinar. So for the last 30 days, we've had the chance to interview Ozone practices all over. As we were talking to them about protocols, there came to light some patterns that we felt inspired to kind of bust open and then to help fix. So this webinar information is 30 days in the making at least. It's been 30 days since I've done a webinar, and the last one I did last month was with Serbo. So it's been a couple of months since I've really been able to connect with you guys. And although virtually it feels, just for the last couple of days thinking about this, I felt energized to be back with you all. You definitely inspire us, you motivate us, you represent us. So thanks a ton for being here. This is the medicine that we love, and you guys are the people that we want to support. So before I get started, I want to set the stage a little bit. I want to just take a couple minutes to set the stage for the conversation today. I want to help you get settled into the mindset you're going to need to be in or remember throughout this meeting. So if you're able to, please set down your phone for a second, your pen, your computer, possibly even close your eyes. Just don't shut me off. You're going to have to hear me in order to go through this exercise. So just think about this. If you have an IV room, I want you to picture in your mind what that looks like. If you don't have one yet, then use your imagination to think about what you would like it to look like. So how many chairs do you have? You have one room, do you have multiple rooms? But how many chairs do you have? If you have an e-boom, maybe it's a separate location. How clean is it? How calm is it? Maybe it's not. How are your patients feeling when they get into your IV room? How does your staff add to that feeling or subtract, possibly, unfortunately? How do they add or subtract to the feeling and value for your patients? And how does your staff add to how comfortable you feel with your IV room? So what is the general ambiance of your IV room? If you are the staff listening, let's say you're a nurse and maybe you're at any level, but you administer, think about how you feel going to work every day. Is it amazing, controlled, comfortable workspace to be with your doctor and your patients? All right, so now that you're thinking about your IV room, you kind of have this image in your mind. Think about the process it takes for you to prescribe or refer your patients to your IV room. So when you see them in consults, are you super excited to share your services with them? Do you think without doubt you have IV services that can make a difference in their health goals? When you do prescribe IVs to your patients, what does that process look like? Does that give you a little anxiety thinking about writing personalized treatment plans for each patient? Or is it a simple process, maybe even a click of a button? When you attach that order for IVs to your patient's chart and it's about to reach your staff, how does that make you feel? Do you feel nervous at all to what's going to happen next? Do you worry what your staff will think, all the questions that they're going to ask, or what they're going to do? Or do you feel confident that they're on board with IVs, they're well trained, documentation is in place? Do you know that there is little room for error and they know exactly what to do from there? So if you feel joyful, excited feeling when you think about your IV room, pick up your phone or get back on your computer and put a thumbs up in the chat right now. If thinking about your IV room gives you lots of enthusiasm, gives you lots of relief, gives you lots of joy, you're so happy with it, then get in the chat right now and give us a thumbs up. If, as I walked you through your mind's view of your IV room, you sensed any feelings of frustrations, stress, maybe even some overwhelm, pick up your phone, get back on your computer, and put a thumbs down in the webinar chat. Just want to get a sense. I'm guessing if you're here, it might be a little bit more of the latter. Maybe you're just curious. Maybe you're just interested in what top 50 clinics have to say about all this. But we spent a lot of time talking to practices, and we know that there is some frustration, some challenge, and so forth. But if you really think about what your IV room is doing, eliciting in your response to just thinking about it, we want to hear how that is for you. All right. And any of those who were driving or cooking during that exercise, you're going to have to call your insurance carrier. You're going to need some help to handle all the collateral damages just now. In all reality, I know some people are driving, they're doing other things, and that's super cool that you're still here with us. So in all seriousness, this little mental exercise should tell you exactly what the status of your IV room is. If you don't do IVs yet, then you should just know that it's usually going to go one way or the other. It's going to be super joyful and exciting and enthusiastic. Your patients are going to love it. Your staff is going to love it. Or you're going to come up with some of these bumps in the road, some of these challenges, and it's going to get stressful. It might even be a drag on you. I know a lot of providers are just like, again, if you think about what happens if I order IVs, it's like all sorts of chaos might start to take place if you think it through. So it can go either way based on your intent with preparation and organization. All right, so MedMasters' main focus is to be a resource to all of you, no matter what the stage of your IV intentions are and beyond. So our accumulated experience has sent us to dozens of countries, worked with thousands of providers who have delivered over 3 million IVs. It's a lot of IVs. I've personally done over 20,000. We want to serve the industry first and foremost by helping great regenerative and functional medicine practices reach as many people as possible. Again, you represent us. We love this medicine. We practice this medicine. This is what I choose to do. This is what my partner Vicky chooses to do. Like, we love what you do. We want to serve that. And secondly, our mission is to protect the patient, the provider, you guys, and the medicine as we're able to, reach as many people as possible. So let's get into why you're all here. You all responded to the call for the potential to need standard of care, right? We solicited this idea of standard of care in Ozone IVs, even those of you with EBU. And I told you when I write these emails out to you, it's like you could have EBU or any level of Ozone. And so I looked over the list of registrants this morning before I left home, and I know many of you. I know some of you have don't have IV services yet. Maybe your license even is really difficult for you to have IVs, chiropractic, etc. I know some of you have a desire to offer great IVs. You're kind of tinkering with it. And some of you have just been able to dive right in. And even your first Ozone purchase or Ozone IV was EBU. So we have a variety of listeners, and I just really hope the message will resonate with all of you. And don't forget, as always, put any of your questions. We'll have time at the end. Put any of your questions in the chat. I would love to answer those as we go. I got to go fast, but this will get technical. There will be a lot of information. We want to clarify it for you. So we'll get to questions in the end. All right. What is the premise of healthcare? Do no harm. And we want to focus on safety and efficacy, right? That's where we come in with protecting the patient, right? With what's safe, what works, protect the providers there, and protect the medicine in general. Because this is often not FDA approved or off-label use, etc., we have an obligation to protect the medicine as well. All right, so my goals for tonight, we talked about it. I want to try to highlight and show you the benefits of creating standard of care in Ozone. I want to talk to you about what our top 50 clinics are doing, clients are doing. Ozone is kind of the common denominator here, but it gets into stacking all types of IVs for best results or to help us create this standard of care. So the standard of care concept, it might be another opportunity for a little mental exercise here, but what do you think of when you think of standard of care? I know, speaking with lots of you, it might actually be part of the reason why you chose to kind of shift away from conventional medicine. It might give you a little PTSD to think about somebody else, the system that kind of dictates when, how, why you treat patients. I totally get that. But I'm asking you to kind of hang on with this concept for a minute and consider, I want to propose a consideration for our functional regenerative and whatever space you find yourself in or you label yourself in, medical industry. So don't throw away, I'm asking you not to throw away the baby with bathwater. Preserve the good while embracing change. I love that concept with this. So acknowledge existing success with standard of care. Recognize the value, it maintains successful elements. It helps balance innovation and tradition. It helps us be a little cautious at times, which we might need, some of us more than others, but and maybe a little curious as well. It also, I think I might be missing a slide, maybe not. So there, it provides all the benefits that really help support consistency, communication, and so on. So again, it might, you might have wanted to get away from some elements of standard of care, but I think that there's also a purpose to it. So as we talk to all these providers, and this goes back far more than 30 days, there's, with Ozone specifically, and with a lot of these medical tools, there's some top big concerns. A lot of the questions, or a lot of the providers ask us the same questions, like, how do I know this is going to work for my patients? It's not what you learn in medical school or nursing school, right? So how do we know it's going to work? Where's the study or research behind it? And that kind of leads in, how do I maintain credibility with my conventional colleagues, which might be your malpractice? Maybe it's your, how do I save face with my conventional training? I went through all this training and learn it differently. And how do I maintain credibility with the evidence-based mind that most practitioners have? So I want to suggest an alliance of providers as you guys, you hold the keys, and you maybe have an obligation to create a standard of care that will do both. It'll help ensure better and higher volume of positive results for patients, as well as collect large databases of information that reflect our cause-based approach, focused on cell and systems biology, right? Like, we're coming at this differently. We all have an obligation to put into that, to help maintain it, to possibly create a standard of care. So it's really up to you as sole proprietors and stewards. The worst it could do if we start creating standard of care and collecting data is provide evidence to safety and efficacy and theory of use in the event that one of us gets called to the carpet. So let's take a look as a reminder, and let's work to pull out some of the benefits of standard of care. So it improves patient outcomes, consistency in care, evidence-based practices. It helps enhance patient safety, minimizes errors, and mitigates risks. It increases efficiency, or can increase efficiency. It streamlines processes potentially and eliminates unnecessary variations in treatment. It also provides legal protection, so it can shield you from liability. We all want that. It sets clear expectations, crucial for defending against claims. I have been part of some claims. I've worked with practitioners, sometimes right in their office over the years, where they did have to defend themselves. And if we can show structure of standard of care, why, how, when we chose to do things, definitely is beneficial. It also provides better communication. Common language between all of us improves patient understanding of care plans for sure. It provides continuous improvement. It establishes benchmarks, right? I want to talk about that a little bit for quality, evolving practices, and trust and credibility with your patients. So you could pull up gobs of studies that talk about how we need to continue to work on that. Medical school does not teach it very well. They've been working on this for 5-10 years to just help providers learn how to create trust and credibility, because that leads to compliance or leads to lack of compliance. So, does this resonate with anybody? Is this, I mean, maybe you're someone who hasn't taken the time to think about standardizing your office to some degree. It's really interesting. You get away from the system, you become sole proprietors, you own your own business, and now it's up to you in this space of medicine to create your own standard of care. And maybe that's just been overwhelming. Maybe you just haven't had time. Maybe you really didn't want to, because maybe you're someone who felt, you wanted to, you want to work under the pretense that you customize every single detail for every single patient. Does it seem reasonable to think of a whole medical industry doing that? Every time somebody comes in, for every single IV, every single patient, every single diagnosis, every single symptom, that we're kind of customizing every little bit of it, because then how does that help us in terms of creating evidence to support your prescription of the IVs, or make a case for entities to look at it as safe and effective? Does it depict an office environment with low risk for human error and litigious repercussions? Does it support patient empowerment and compliance if you don't have, even within the four walls of your practice, your own standard of care? So MedMasters had the opportunity to interview 50 EBU and Ozone providers just in the last 3 days. So that allowed us to single out some data points that could provide insight as to what gets the best results and diminishes the chances of adverse events. If you guys if any of you are EBU providers and you met with us, that was really what we were wanting to do. We've seen some adverse events a little bit more severe in EBU than in other types of ozone practices. So we appreciate you meeting with us. This is part of where we got this data from. And if you want to meet with us to go over your protocols, to go through adverse events and how to prevent them, etc., that's still open to you. We can put that link in the chat, I guess, to schedule. We scheduled 45 minutes to really review that with people. So that's still open to you. But the next section gives light to what we learned. And it hit me that if we elevate our EBU/ozone standard of care, we could all be as successful as those top doctors, those top practices. And as our marketing for this webinar said, some of it isn't even about the IV poke or the IV stick or the needle itself or the IV ingredient itself. It's patient psychology. It may be the first indicator of how well they're going to respond to ozone or to any treatment. So here's what we learned. These 3 secrets, these 3 keys to success. Number 1, like I've mentioned so far, we need to form some alliances, work together to create a proposed standard of care from what others have had success doing. That's what hit me. Like, I wanted to present this. I was so excited to give this to you and to be able to facilitate, again, some of these data points that help us elevate our standard of care. Key number 2 is to set proper expectations. So patient selection, education, and preparation, all geared towards the patient. And number 3 is, how do we stack these therapies? Because there are no silver bullets. Ozone's amazing. I don't care how you use it and what you put it with. It can be a key difference in your patient care. But it is not a silver bullet, and doing things collectively can have a lot greater results. So forming alliances, working together. I just want to bring this up. I gave a presentation, if you saw it, with Serbo last month, but it's really cool to think about the differences between something like functional medicine, regenerative medicine, and conventional medicine. So it's healing versus management. It's innovation versus established practices. It's looking at chronic diseases completely different. Regenerative medicine, functional medicine, I would say, is the same. It holds the promise for chronic conditions by addressing root causes, right? That's why we're here. Whereas conventional typically treats long-term, management strategies, right? Like, we just don't like that. And then if you look at cost and accessibility, this is a big barrier for a lot of practices and patients, but conventional medicine is generally more accessible and covered by insurance. I get that. And regenerative medicine treatments can seem a little bit more expensive, but look at the outcome, look at the difference in what we're providing. So you guys are unique. You guys stand out. You guys need each other. You guys have to come together and create these alliances to help us all do better with safety, efficacy, and prove exactly why we're doing this. And again, it's collecting. I just feel so fortunate to be in a position like MedMasters loves this idea of being able to talk to you all and collect this data, and then to be able to disseminate it back to you so that we can create a standard of care. All right, so looking through the top 50 clinics, these are the things that kind of the overviewing topics that we pulled data points on. What are their standard operating procedures? What testing are they doing? What treatment plans? And it bridges with standard of care. What is their standard of care? Like, there is a minimum, right, that they will do in order to get best results. How do we set those proper expectations? And then the patient education side of this. So first, standard operating procedures. It's much like standard of care. It's the same warm and fuzzies that we get from both. Obviously, there's aspects of it that we want to let go of. That's, like, we just don't want to treat everybody the same, no matter what they have, and have to be forced into a system. But it does, we can learn from the benefits as well. Consistency in care, enhanced patient safety, improved efficacy, legal protection, better training for us, our staff, and that leads into even education of patients, continuous improvement, right? We can see what's working, what's not working, enhanced communication along the way, and regulatory compliance. So what does the standard operating procedure look like? You should have a lot of them in your office for everything that you do. Here, we're talking about EBU generally, but all IVs, and Ozone generally has a process in terms of IV that's a little bit different than other types of IVs. So the basics of an SOP, what is the purpose of this procedure? What is the scope of this procedure? What are the responsibilities, or who does the responsibility land on when doing this procedure? What does the procedure itself look like? Emergency protocols to the procedure. A review and update, or when do we do that for the patient? And then who approved this procedure or this SOP? And again, why do we do this? It's great for training your team, your staff. It's great for holding them accountable. It creates documentation. And if you do it ahead of time, the documentation is just done for every single IV or EBU, et cetera, that you're doing. It might actually help you fire somebody that's unfortunately not following standard of care, right, for your practice, which then ensues safety. So EBU SOPs is definitely something that the top practices are doing. So I wanted to make sure this was easy for you. And at MedMasters, we created EBU standard operating procedures. It's available to you. If you have an EBU, we also have it for O3UV, not O3UV, but the basic Ozone IV procedures. But there is a standard operating procedure that should be documented every time somebody in your office gets one of these IV therapies. So again, I didn't want to just talk about what this all is. We have worked the last 30 days to provide it for you, create it, so you can just have it at your disposal really quick. All right, testing, looking at the top 5 practices. This is a little bit unique, right? What scope of practice do you have? What are your skill sets? Where have you decided to focus, right? What brings you joy? Is it chronic disease? Is it functional medicine? Is it gut? Is it hormones, right? And some of you are very broad and do a lot of things. That's a little bit unique. It's also based on the type of patient you're looking at, the goals of the patient you're talking to, the qualifying your patient, the budget of your patient, the intake and history of your patient, and then how that all collides with your scope of practice. So it's a little bit unique, but we can say that there's a little bit of focus as well. People are using EBU and Ozone for some specific things. But the basic CBC, CMP, G6PD, that was something that a lot of people did not test for years ago. When I first started, it was not very common. I used to say 1 out of 10 doctors. I'd say a lot more testing for it now. A1C, lipid, and people are getting creative with that, right? There's better markers for lipid peroxidation and fat panels. So those are some of the basics. Inflammatory markers, we know that EBU is going to affect this real quickly, but cytokine panels, autoimmune titers, metabolic testing, it's something I'm really into right now. PNOE is one of my favorites, but actually looking at how the body metabolizes everything we consume. Functional testing, so stuff like gut testing, gut permeability, microbiome testing, and then there's specialty testing, Lyme mold titers. You just want to create that benchmark, create that standard of care that says, we tested this, and now we're going to do some therapies and find out if it's working. Right? That's really what standard of care could look like. That's the simplicity of standard of care in your particular practice, but you want to make sure it's consistent, right? How do you know, how could we gather data and say something is or isn't working if we're not testing for it? I will also throw in here that these are labs, right? These are blood tests, however you want to do it. There also is the benchmark of what the patient reports to you, and I'll talk about it in a second, but that is also something you need to track. How does the patient actually feel day to day? What is their quality of life? How is it improving? Where's their energy and motivation levels at, their gut, pain levels, all that stuff. So there's both, and they will both change or not change, right? There's these ups and downs, these ebbs and flows in patient care. But you definitely want to create your own standard of care in terms of testing. Maybe it's based on the patient in front of you. So then moving into treatment plans and standard of care, after interviewing a lot of providers and hearing what they have to say, I feel like it kind of comes down to 2 main premises, and you really need to ask yourself how you do this. What are the phases of disease or phases of aging or phases of treatment, how they correlate, right? Phases of how do we get sick? How do we degenerate? And also then what would be the phases of treatment to target those, and or they're looking at cell biology or systems biology. So the first one kind of looks like this, and I was just doing some consulting with a client. He's amazing, out of Canada. I hope he can be on our podcast soon. Without giving too much of his IP, we kind of broke this down, and a lot of people do it this way, but again, what causes us to get sick? In functional medicine, there's only 4 or 5 causes of disease. It's kind of leads into that, but there's a detox component or chemical toxicity slash detox, right? Component, if you're familiar with the 4 R's protocol, or reactive oxygen species is what kind of builds when the toxic load is so high, the antioxidants are low, the oxidation's high. So there's that category of both how and why we get sick, and then what we can do to treat it. So I wanted this graphic. I didn't have time to kind of draw some lines here, but next might be your building phase, your nutritional deficiency phase, right? So phases of disease, phases of treatment. Hormonal imbalance slash metabolic dysregulation, those tend to go together. Infection is another cause. Mitochondrial dysregulation, dysfunction slash inflammation, those tend to go together. Over on the right, I was listing just, there's some of my favorites right now. There's reasons for that, but this is really where regenerative medicine is trending. In chronic disease, we've been using a lot of these also. But again, I wanted to draw some dots. If you look at detox, chemical toxicity, 4 Rs, reactive oxygen species, and you've got these simplistic IVs to the right, and you guys might have hundreds of formulas, hundreds of ingredients, but standard of care requires that we simplify this somehow. We simplify how we look at every patient. And so again, I when I consult, I'm like, let's simplify your IVs, or let's build out treatment plans according to how you treat and what you treat. So on the right, glutathione, ozone, procaine, poly-MVA, methylene blue, peptides, bio identical hormones, or hormone therapy. That's a big one, right? And biologics, I'm talking about human cellular tissue products and so forth. These are the top ones, like these are like what everybody is leaning towards and getting into using. Myers cocktails and high dose vitamin C, they're all there too, but this is really where medicine is trending. I'm in Austin right now to meet with a new franchise. They've already sold over 100 locations, and guess what they're using? So how does your treatment fit the way that you treat? The other way that I noticed, again, 2 ways that we were able to pull out some patterns, is a lot of people, a lot of practitioners will approach treatment plans or standard of care in treatment plans towards, again, system or cell biology. So you guys know this so well. We start with the body, it breaks it down into systems, organs, tissues, cell, mitochondria, and even electron transport chain, right? Different parts of the cell and how they work. And if we can get to that core premise of why we age or what goes haywire as we're exposed to infections, toxins, and so forth, that same list of treatments or IVs on the right can still be tied together. So again, think of terms of how do you treat? What types of patients do you treat? What types of conditions? And standardize those protocols. I'm going to get much more into this in a second. But treatment plans and standard of care, those top 50 clients are doing it. If we're talking about EBU specifically, or ozone, this has become part A, bare minimum standard of care for EBU especially. And the reason is because it is more effective. So it does have a little bit more immediate and severe reactions, like low blood pressure, low blood sugar, and some other, I think the body's just talking to itself so much better, and it's kind of like an inflammatory dump. And that's my own hypothesis, but Jason and I concur all the time. We speak to all these providers, and we don't know exactly everything that's going on, but EBU definitely is efficient and intelligent. And so some of these typical side effects of ozone seem a little bit more severe in EBU. But as we interview the people who have the fewest side effects, the fewest detox reactions, they have created a standard of care. It's bare minimum. Again, there's no silver bullets. They will not allow their patients to do just ozone or just an EBU. What does that look like? Here's a little bit of a teaser. Day one treatment one might be a Myers cocktail or a poly MVA with some vitamin C and some hydration. We want to pre-treat the body. Hydration is definitely a big component of that. Then you've got maybe day one treatment two. If you're doing some biologics, we met with Jason, interviewed on our EBO mastermind last month, a client in New Jersey, and she listed out she's got pretty standardized protocols. She treats everybody very, very similarly. And she doesn't let anybody go without all the bells and whistles. It's like if you come to her office, this is how they do it because it ensures the best outcome. And that's what everybody wants. And they use biologics. And after Jason interview, we had several people, handfuls of people say, what is your protocol? What is your protocol? What is your protocol? So I wrote it up. We went through it. We wrote it up. Day one treatment two might be these biologics. Day two, that's a typo, I think. So day two treatment one, that's when their EBU with methylene blue would come into play because we're now supporting mitochondrial and cellular function. And then that same day, treatment two, however you want to look at it, treatment three, they'll add a glutathione push as detox support. Now you might look at this and mix and match this, rearrange the order a little bit. But what I'm telling you is after interviewing all these providers, this has become, if you do it this way, we see a lot fewer detox, Herxian reactions, a lot fewer side effects or adverse events, including simple things like vasovagal and, well, we'll get into that a little bit more, but definitely the low blood sugar and low blood pressure. So can you elevate your ozone IVs by ensuring that people don't just do an EBU, they do all of these things as well? As mentioned, once we gathered all this information, we created it. So this is a document that, yes, it does talk about what I just said, but it gives the particulars too. Everybody wants to know, like they were asking BEMA, okay, when, how much, how far apart? We know the answers to that. And we wrote it all up. So now we have an EBU standard of care treatment plan. And it's real basic, pre-treatment, during, the cellular, et cetera, support, and then the detoxification support at the end. And that has become the standard of care for EBU/ozone. All right, next though, secret number two is setting proper expectations. So patient selection, education, and preparation. All right, setting proper expectations. This comes down to patient screening. He also, I guess this was last month, the month before was BEMA, but we interviewed a practitioner. Jason's so good. He asked these providers, like, over the course of your experience, doctor, nurse practitioner, provider, what is it that you would do different? Like looking back, what would you do different? This guy says, I would screen my patients differently and better. Which basically says, are you committed? Is your patient committed to the full experience? Are they coming to you for the cheapest price? They come into you for the I can't say that word. Are they coming to you for what the hydration bar across the street can do? Are they coming to you for, just standard of care, meaning urgent care, etc.? Like, select who you want your patients to be, screen them for that, and make sure they understand what your best offer is so that they can then commit to the full experience. Why do we not just do EBU? Because when we do nutrients, we build, we detox, we support cellular function, etc., it goes way better. We don't want to slight the patients and jeopardize their outcome because of all these other kind of, I don't know, less relative factors. So patient screening is a big one. Do you have written explanation of services? Do you have written instructions on what to expect? A lot of the top providers do this very well verbally. And I can tell you that those that are the most successful, meaning they see the most patients, they make the most money, their staff have been there a long time. This practitioner I'm consulting with, his nurses have been with him 5+ years, which is almost unheard of. Most practices have a 25% turnover rate every year. And a lot of that has to do with how they perceive and communicate the services. So they verbalize things, but What they don't have were written explanations of services, written instructions on what to expect, something to hand the patients over and over and over again to take home, to share, to reread, reread, and reread. And that is what they said. That's the one thing that we would love to have. Informed consents. A lot of you aren't doing informed consents to the degree that you should. And the last thing for setting proper expectations for your patients and your staff is that you have to enforce it. Right? This is how we do it. This is why we do it. This is guaranteed to get you the best outcome based on what our industry standard of care says. And so that's the way we're going to do it. We don't want to cut corners. So in order to help you guys do this as quick as possible, we also created an EBU procedure prep sheet. This is what we've called it different things, but this is what to expect, right? You hand this to your patient, and you're like, this is how you prepare for EBU or ozone. This is what's going to happen during your EBU or ozone. And this is what the post procedure or DC instructions look like, right? This is what every patient needs to know when they come in mentally, physically, financially prepared. The procedure goes better, less side effects, less detox. And then we also created a new informed consent that goes through a lot of those same things. Like, again, when the patient's mindset is in the right place, they don't freak out, they don't question, they have a lot more confidence. And this is all going to help your staff do the same thing. All right, setting proper expectations, standard of care part B. Part B, right? The first part was the medicine. That's the cellular stuff. It's the system stuff. It's how to support the processes, the body, the healing processes the body's going to go through. This is part B, which is more, which is a little different. So patient evaluation is your patient has to be able to report to you. If you want to collect data, if you want to know if something's working, you got to ask them. You got to ask them how they feel. I actually personally years and years ago started to develop this sheet. Some of you have probably seen it. I call it the patient evaluation form. I've learned how to ask these questions. I've learned how to implement it so that you're getting basically a SOAP note. You don't, and SOAP notes or asking questions in IV room might make you feel a little uncomfortable because you're thinking, I can't handle these questions. That means I got to customize the protocol, right? They tell me something, I got to change it. That's not what it means. I mean, maybe eventually, but you don't have to do it right then. And how do we do this HIPAA compliant when we're in an IV space? This form does it for you. The next thing is triaging, right? In the moment, what is your standard operating procedure? Is the nurse required to make sure, document, make sure that they're hydrated, they've had high protein fat food or meal in the last 2 hours, and how are they neurologically? Where is their emotional state? If they come in all frazzled, this isn't going to go well. This is where we see the vasovagal. It's sometimes intense vasovagal. This is where their veins won't cooperate. In EBU, you need two veins. It's all about their psychology, what their energy is when they come in. So you've got to make sure that your SOP, standard of care, says that we are following protocol. And we're not going to do an EBU if you don't follow instructions. That's what I mean by enforcing it with your patients. Informed consent is a big one. And all I mean at this part of the visit is your nurse making sure that they have signed their consent form, that it's informed consent. Does your patient know what they're doing? Do they know what it's that prep sheet? Did they prepare coming into it? Do they know what to expect? An EBU, they're going to get two pokes, a lot of blood coming out. And if you met with us, we shared this with you. This does set you up for failure if your patient is not really understanding what this procedure is going to look like. Many of them will start to panic in one way or another, and their bodies respond, right? The psychology, the physiology comes second. And so informed consent allows them to process it, think about it, be prepared for it. We see a lot fewer side effects, and we see people therefore able to get their therapies and also get responses to it. Do they have any final questions, right? And that's what the written SOAP note does, is allows them to write their questions so you can address them at any time, and it keeps everything HIPAA compliant. The vitals for sure, standard of care for EBU is to collect blood sugar before, during, and after, blood pressure before, during, and after, and SAT levels. before, during, and after. It is not something that should be jeopardized or considered. It, like I tell my daughter, when I give her instructions, I'm like, this was not a suggestion. This wasn't up to you. I didn't ask for your feedback. This is what I'm telling you has to be done. This is standard of care. Standardizing these operating procedures will give you the best outcome. And yes, EBU is EBU, but this is with everything. And when I wrote the emails to get you guys here, it was like, you may be considering eBoot, you may just be considering Ozone, you may already have it all, everything in between. They're all a little bit different how, it doesn't matter if you have a 10 pass, if you have, which eBoot you might have, they're all a little bit different, but this has become more and more obvious, especially as Jason and I have met with so many practitioners, and it doesn't just happen with eBoot. We have seen these adverse events, these severe adverse events, I would dare say post-pandemic, really start to creep up and become more common. Is it because people are more sick? Is it because the therapies are more aggressive? Maybe a little bit of both, but that's eBoo's not more aggressive. It's a really low concentration. And so it's not just eBoo though. It happened. We've heard it happening with Tempass, with methylene blue and poly-MVA. Like, it's happening. It's going to happen. This is why creating standard of care is so important. So when it does happen, you have policies and procedures that protect the patient, protect you as the provider, and protect the medicine. All right, the last thing that most people aren't doing, even the top 50 clinics, but they said they would love it. It would be so helpful. And I've been using it for years, so I know the value of it, is patient education. So again, on the screening side, you're asking them again, now that you have all the information in front of you, are you committed to this? Are you going to follow our protocols? Are you going to, buy into our culture? Are you going to take your supplements, change your dietary plan? All of these things, because that's going to get you the most out of your money and the therapies. Do you have written explanation of services? The questions are never going to stop. They're never going to stop coming to you from your patients. They shouldn't. I hope they don't. The more that you teach, the more that you help them, the more that they learn, the less they know, right? They're human just like us. The more we know, the less we know. And so the questions are going to keep coming, and we forget it. They're not medically minded or trained, so they need to be written, something that they can take home that says, what is EBO? What is it doing? How is it different than other ozone therapies? What to expect? Also in their informed consent, written discharge instructions at this point, right? Once you get home, this may be how you feel. This may be what you should and shouldn't do, and so forth. And then, of course, none of this goes anywhere if you don't enforce it with your patients. Standard of care does not benefit anybody if it's not enforced. That showed you a picture of, we have not only this handout on eBoo, we have it, I create it for every service that we teach. Again, it's been huge in my career in terms of being the liaison between the provider or the science and the patient and their understanding. These written things really help create clarity, buy-in, then compliance, which is the only way you can help people get better. So this is a picture of it. We have it available for you. Again, that is the one thing that even the most successful practices didn't have and wanted. So we made it. All right, the last thing, key number 3, stacking therapies. This, I gotta go fast. There's so much science in here, but again, there's no silver bullet. So going back to part A, the bare minimum that we're recommending that you do with your eBill and Ozone is to have a 2-day, you can choose 2-day or you could do it all in 1 day. Most providers are doing it in 2 days. Are they back-to-back days? I know you're going to ask all this, but we did write it out. Day 1, week 1, we did write it out. It's available to you based on, again, what most other good providers are doing, are successful providers. And I don't mean that in a condescending way. I'm sure you're all successful just by being here. You're successful, but go back to the very basics. At minimum, this is what is required to get the best outcome and to be safe, low herxine, detoxing, and adverse events. I'm throwing out here these fundamental therapies for IV room. You guys can have your own, but looking at fundamental nutrition as a catalyst right, if you look at what Ozone is doing, no matter what the dose, etc., the way that you administer it, what are the catalysts or cofactors that are really going to help that process? I'm in love with Poly MV. I've used it for a long time. It's a proprietary blend, a little bit of a bougie, if I can use that word, bougie way of elevating your Myers, but also a little bit different. It doesn't negate vitamin C and some of the other things that you're doing, but you're talking also basic nutrition. I'll talk about a little bit more circulation, antimicrobial, redox capacity, cellular respiration, ozone you, and if you got a light therapy, you guys know we're big fans of light therapy. There's a couple great ones out there. They can be standalone therapies that do their own great work in cells and tissues, but the combo there or not. Antioxidant phase 2 detox. Again, you're looking at phases of conditions and diseases. What is the best treatment that's so broad scope? Glutathione is one of the best antioxidants. Phase 2 detox, great stuff. Krebs cycle, electron transport chain, antiviral, neurocardial protective, methylene blue, so universal and a big, like of all the products we've sold, that's the one we've sold the most of. Obviously, a big topic right now. Cellular communication, stress reduction, Procaine. I've got scheduled already Dr. Suzanne Fury, who's also teaching on Procaine and neural therapy November 1st and 2nd in Georgia. I don't think she's released her website yet, but I've got it if you want to go take that. But I can't leave out Procaine. I've been teaching it to a local provider. Amazing stuff. Like it has changed people's lives in the last 2 times. I've done 14 IVs on people. Total had 14 different responses and like crying to me about how much it changed their life with 1 or 2 IVs. So can't leave out Procaine. If we break these down a little bit, EBU. EBU, it's out there. It's in operation. We have been able to contribute to much of that. 17,000 procedures completed. If you don't have EBU yet, or you're just thinking about ozone or both, then we still love O3 UV's full spectrum, but there's others out there. Have no problem if you get any of the others. The O3 UV just has the light, but it is the top dog in terms of ozone, but there's much to learn and much to train on. And just again, want to pull this out there. We do this all the time, but this really gives a lot of, this gives you, ozone gives you superpowers in your practice. Like it just does. It means you have a lot of superpowers to pass forward to your patients and really a lot of things that can target. This is just some results that I was able to help facilitate through SOTMed the last couple of years, 2 phases of study for EBU. Some of you have seen this already. It's a slide that keeps popping up because EBU works, and EBU is more efficient than all your other ozone services. So in terms of decreasing inflammation, in terms of mental clarity, energy, drive, etc., with your patients, it's not a silver bullet, but it's huge. It's huge. So talk to us, meet with us. We definitely can help guide you there. Methylene blue, again, what is going to get you the most bang for your buck? Electron transport chain, donates and receives electrons, neuroprotective, acts as an antioxidant, antimicrobial agents, cognitive, phytoexcitation. What that means is it actually creates more electrons when you introduce it to light. So light therapy on its own, light IVs, they can be a standalone. They do better with ozone. They do better with methylene blue. But this is standard of care these days for EBU is to add methylene blue. That's standard of care. That is what is getting better results. I told you we interviewed all these practices. I'm sharing with you the data points. This is where it's at. Procaine's a big one. People they underestimate it, but I just want to throw in here again, geroprotector, nervous system reset, pain relief, anti-inflammatory, vasodilation. It also works as a bit of an antioxidant, cytoprotective. I've also listed here the places we referred to. Procaine's hard to get. Texas Star has been making it and producing it. I just got some from them last week, so I know they still have it, but want to give you those resources too. Poly MVA, we're gonna have him on a podcast in the next month also. I haven't had him speak. He was on a webinar with us at SOTMed, but I haven't had him speak for us in a long time. And so he's going to be on. We were having this really off the cuff conversation the other day. It's just amazing. I asked him, we already knew what it did with ozone, but I asked him, what's your now take? What are you hearing from your providers when you do poly MBA and methylene blue? He's like, oh, it's amazing, right? They like are again synergistic or catalyst to each other. So we're talking about how it amplifies also the electron transport chain, bringing, sorry about the typo, more oxygen to the metabolic cascade. also donates electrons. It also helps with the synthesizing complex 1 through 4, just like methylene blue does. Methylene blue actually allows the energy production to skip from 1 to 4. So it produces more energy without as much energy. Causes conversion of NAD in the cell, unique redox mechanism, jumpstarts your cell battery. This is becoming standard of care in combo, synergistic, stacking therapies. I know all these questions are when, how much, how often, what types of patients. We have it for you. We have it for you. We wrote it up in protocols. Peptides, can't go without that. Peptides is definitely buzzword. It's definitely hot topic, not just the weight loss stuff, but man, there's so many benefits to it. And again, if you look over to the left, if you think about what causes disease, what areas of function do I need to target with my IVs? Peptides, they're not IVs, they're injectables, but they go so well with EBU. EBU and peptides, EBU and methylene blue and peptides. It's my favorite. I'm addicted to peptides. But again, you look at all the different reasons to use it. It's just a universal tool. There's a lot to learn with peptides. I'm not going to lie to you, but we've got some resources for that too. If you heard me talk at Sorbo, you heard about True Dose. This is a biologic. It's a platelet-rich plasma IV. Not going to spend a ton of time on it. A lot of you probably already know what PRP is, platelet-rich plasma, but there is a new procedure for IV that also, you know, you give the patient their own ability to heal and then excite it or create efficiency in the process with EBU and these other IVs. And again, when we interviewed Bima, this is all the stuff she's doing. This is what I am here for in Austin. Again, is these are franchise opportunities now. This is what is going to be mainstream in the next 5 years. Human cellular tissue products, I like Vidi Labs, but you might have your own. Again, you're looking at universal regenerative therapies, right? Cell replacement, paracrine effects, scaffolding, immune modulation. If we go back to detox, metabolic syndrome, mitochondria disruption, all of these things approach those things. I am not going to spend a ton of time on this. You guys will get the recording. The slides will be in there, but this is an example of how you would create a standard of care. Treatment number 1, classic Myers in the dose plus glutathione. Number 2, you've got your O3, maybe your UV treatment in there, plus you can add procaine that day. Treatment number 3, you'll see, is just like treatment number 1. You just increase the doses. Treatment number 4 is just like treatment number 2. You just work up your way in dosages. And this becomes, again, qualifying your patient. Are they committed to this process? Because if you just do it once or twice, even with EBU, you might actually see not downsides, but that's where you will start to see those adverse effects. It scares you. It's scary to you as the practitioner. It's also scary to the patient. But when you do this stuff, you really see physiology change. I have a couple of clinical cases here to just show you. This is standard ozone only. This is from Lexi Yu. If you've seen any of her presentations, I borrowed it from her again. But you see, all she did was ozone alone. It can be amazing. And when it comes to gathering data, you all know better than I do that if you don't isolate a treatment, you really can't say what is doing what. And it kind of rubs against this philosophy of stacking IV therapies. But again, look at synergy, look at catalysts, and look at opportunity to do multiple things and support the body as it's going through its healing process. But she did this on a patient. C-reactive protein went from over here, the older dates on the right, December at 770, and then came all the way down with just 6 treatments of ozone. She does have UBI with that, down to a much lower and reasonable and regular pace. But I've got some others here with like ozone and methylene blue, and they didn't do ozone alone to know that the methylene blue made it better, but it makes a lot of sense. So pre-treatment, LDL was 191, came down to 140, total cholesterol 275, stayed about the same 237, but small LDL had a significant change. Here's another one, ozone, methylene blue, and glutathione is what this practitioner did. I think Jason gathered this from one of our clients for thyroid. Look at TSH, 6.76 to 3.66. T3 stayed about the same in this case, and T4 was improved also, but major changes in thyroid function, lipid panels, inflammatory, we're looking at changing the foundation of health with these therapies and stacking them is what the top 50 practices are doing. So now you can see, hopefully, why all the best clinics do this, why stacking IV protocols is part of standard of care. And I hope that this resonates with you. I hope this is good news to you and it can help you see, see where this can go, see why you would want to implement standard of care, even if it kind of gives you a little bit of some PTSD from your conventional days. But let me ask you a question. If you follow just these three things, standard of care concepts based on working with each other, we don't have to talk to each other face to face. We don't have to be in the same room, but we definitely can we can implement certain protocols, collect data on it, stacking IV therapies, that leverage synergy, reduce reactions for best patient outcomes, and you can produce an incredible patient experience by setting those proper expectations, right? And protect them, safety, efficacy. If you did all that, do you think you could double your IV production? And that could be monetary, sure, that could be money. But putting all of these policies and procedures in place, they could make you so efficient. Remember in the beginning, it's like, how does this make you feel to think about how your IV runs? If that gives you some nervous feeling, then what happens if you implement some of this stuff and your IV production improves? So let me ask it in reverse. Is this exciting to anybody to think about we could standardize this? Like, does it make you so excited like it does me? And it might feel like it's a lot to take on. You might feel a little overwhelmed with how do I put all these things in place? And again, that is how we want to support you. You don't have to feel overwhelmed. We literally have created these products that you could purchase and you could get them in your inbox today and be ready to implement them, like have them in your EMR by Monday. If you see the value in creating some standard of care, some SOPs, and making the bare minimum with your ozone procedures, do all the things it's supposed to do. So we did create this EBU onboarding bundle is what we called it. So this is where I was telling you, like we have some valuable tools to give you. I don't want to just talk about these ideas. I don't want to just, say, hey, you guys should all do it. I don't want to just pull out science that says, this is what one of these things does or the other things does. I wanted to be able to create it for you and to be able to offer it to you. So that's the other thing that I'm so appreciative of my whole team. They really stick with me, my crazy ideas, the work that has to go into this to give each of you a better experience every day. And that ultimately is going to give your patients a better experience. So the EBU onboarding bundle is what we've called it. It's got all this stuff in it. You get the EBU Essentials Vault, which is our original 20 hours or so. I didn't go back and check, but of didactics, FAQ videos, the fundamentals of performing EBU procedures. After interviewing all these practitioners, it's like, oh, we just want you to do it well. We just want you to do it safely. So we want to give you that information, just how to conduct the procedure and do it well. But then there's all this other stuff. So that's why we call it the onboarding. The original is the fundamental, then this is onboarding. Informed consent. I showed you all this stuff, like why you need it, what it looks like, but it's overwhelming to think you or your staff have to create it. So we did it for you. Informed consent, standard operating procedures, standard of care protocols for EBU. This is the EBU onboarding bundle. So again, what, when, how, where, why, how much, how often, we wrote it all out. It's actually fairly simple, but we did it for you. Patient, based on what the top doctors are doing. Patient evaluation sheet, that's your SHOP note. This is the way to collect data from your patient. Patient prep handout, that's to give your patient that says, here's what you do before, here's what to expect during, here's what you do afterward. And then those patient handouts to say, what is EBU? How is this different? So we have this EBU onboarding bundle and we've tested it. We've had clients using this and we've gotten some great feedback. I didn't want to give this to you or offer this to you if it wasn't useful, if it wasn't resourceful. So Dr. Patel, he's like, your materials were extremely helpful. Our team is working on all the procedures and processes you taught us. We've also created comprehensive packages or treatment plans for chronic disease. That's what they do. It's been such a wealth of knowledge. Holly D is in Denver. She's a nurse. She said, I created new treatment plans you trained me on. First person she offered it to purchased it. Guess what? Patients want. They want the best. At least that's your job, is to offer the best. And every single coaching client I've had, that's what they say. I'm so surprised, but that's what people were actually wanting. So she says, grateful for that. Thank you. In the last 6 months, we've changed everything that we're doing. It's been a game changer. It's filling our IV room to have stacked IV treatment plans at the click of a button. And that's with Dr. Steve. So it's kind of funny, like, if this all sounds good, what holds most of us back from making these changes? Probably you think it's overwhelming, you think it might be too expensive. You worry your nurses might like push back on you. They don't want to implement all this stuff. Maybe they're also going to be so excited for it, but you don't have to worry about it. If you could implement it, if you could implement these powerful therapies in an IV room, would it be worth it? Would it be worth some of the stress? Would it be worth a little bit of cost? Especially if we could do it for you, if we could help you implement that. So the onboarding bundle, again, has all this stuff in it. Right now it's on our store. This is why we haven't had webinars, is because we've been working on our store. It's not perfect yet, don't expect it to be, but we have a store now at medmasters.org, and this is there for you for $225 if you want it. And again, we've seen it be so useful. We want to create standard of care for you. You'll get all the materials in PDF format for instant use, or you can edit it. So I'm not pretending to be everything to all people. Your scope of practice, your state, the way you practice medicine, etc. You might need to edit some of this stuff, but it's all editable for your liking. So you could implement it. By Monday, you might need to make a few changes to it. You get to decide. Recorded versions of all those didactic and procedural videos for training now, reminders, review. Again, we just want to make sure you're doing it safely. We just want to make sure you're doing it well, and that you have access to those videos at any time for all your staff. So that's in that bundle. And then all your team can be on the same page with the best practices. So, why does this help? It helps you model the best of the best. Again, our obligation, our responsibility, I think, is to do that, to work together and find out what's working the best, and then continue to do it. It also stops the guesswork of how to grow and follow a proven plan, right? Like, that's why I wanted to share it with you. And it helps you start saving time and money if you invest in this material. I was just talking to a colleague who works in one of the busiest practices that we know. They do close to 30 IVs at least 5 days a week. She herself has administered 600 EBUs. And she said, I would love to have standard of care. I would love to have operating procedures. I would love to have written protocols. I don't have time, and I don't know if the doctor wants to pay me extra to do it. Like, so what if we could provide it for you? It's going to save you time and money. Again, some of the things you might be thinking, is it, what if I buy it? Will I implement it? Or are the materials you purchase going to overwhelm your staff? I promise they're going to come usable and editable. It's going to save you a lot of time, even if you have to make some changes, right? It's always easier to start, to piggyback off what somebody else has started. I also want to put the caveat in here that while we do work with an attorney who's amazing, if you haven't heard him speak, Dr. Jeff, or not doctor, he's an attorney, Jeff Cohen out of Florida. We have worked with him, but he is only licensed in Florida. You need to have your legal team look at all of this stuff to make sure it suits your scope of practice and so forth. But that's not all we talked about. There's the EBU onboarding bundle, but then there's so much more. If you want to stop there, that's totally cool. Go to the store, spend $225. But we also create a methylene blue onboarding bundle. It is what has sold the most so far. Obviously, again, it's a big topic. I take it every day. I love it. It's so valuable, and it works even better with light therapy. So if you got the light therapy, whether it be EBU or anything else in your office, hemolumin, whatever, works better. But we created the methylene blue onboarding bundle as well. And it's $180 on the store, but here's what you get. You get the 1-hour didactic video that I made, presented that months ago now with Lexi Yu. We created a methylene blue SOP, informed consent, patient education handout, And also we threw in the presentation by Dr. Kikuo. He's from New Bio Age, the pharmacy. He is a doctor in pharmacology. That gets in there, and they're offering a 10% discount on all the methylene blue that you order. They've got oral, that's where I get mine. They've also got AV, it's hospital grade. So if you were to do both of these, we could save you dozens of hours studying, creating it. And the thing I think about too is you can go to all these conferences and you can learn a lot of this stuff, and then it stays there. You spend all this money, and it's not that it's not fun. It's not that you don't learn a lot, but you also don't get to implement it because you don't have the onboarding part of it. You have to go back to your office and create all this, and who's going to do it at whose expense? So you might think, onboarding 2 modalities at once is a lot, but I promise you with this material, we make it super easy. They're 1 ingredient IVs. That's one of the reasons I like all those things I put. Poly and VA is 1 bottle, 1 syringe, 1 thing in an IV. So is methylene blue, so is procaine, so is glutathione. But if you get the methylene blue, if you want to do both of these at the same time, or if you've already learned these, but you're like, hey, let's let MedMasters teach my staff how to use it, watch these videos. I was thinking on the airplane over here, this is what I used to do with my staff. I'll pay you $50 to watch all these videos. And then I'm going to have a little quiz for you afterward to make sure you watched it, or sometimes I'd have them write a little report. And at the end of that, they were so bought into, they knew so much, they understood so much, they're just sharing it with all the patients. They're coming to the practitioner saying, what about methylene blue? What about methylene blue? Should we do methylene blue for this patient? So I would literally pay your staff to watch these videos because they're going to get a ton out of it, and you don't have to do the work. It's cheaper to pay them $50 to watch it than it is for you to stand up in a staff meeting and educate them or take them to a conference. And do you think your staff might hate this standard of care, all this paperwork, etc.? I promise they won't. It's like the colleague yesterday. She's a EMT working in this busy office, and she's like, we need this stuff. This is what creates safety and structure and communication. And the biggest caveat we discovered in our conversation is it creates trust. As a staff member, she said it's hard for, she said their office manager is always commenting that them as staff are always pushing back so much on the doctor. Why? Are you sure we should do this? How much should we do? Why did it change for this patient versus that patient? And they've noticed this exchange of what it is lack of trust. Without the standard of care, without the why, without the how, the nursing staff, or in this case, the EMT, is just questioning the practitioner every step of the way. And so again, we wanted to make all that and help it be easy for you. Now, it's not that everything we talked about. Again, I didn't want to present all this stuff until we had solutions for you. If you're interested in peptides, we talked about peptides being very beneficial and they go along with a lot of this stuff. Again, I'm a huge fan. Lexi Yu, Greg Jones, if it's not a replacement for Dr. Seed's course on peptides, but it's amazing. We hosted a while back a 2-day conference on all sorts of peptide conversations, including the legal aspect, marketing aspect, so forth. We recorded it. We sell it for $450. It's available at the store. And that's what we charge for you to be there live. No, we charge more, a lot more for you to be there live, but you get all the resources. There's tons of peptide SOPs, consent forms. I created so much of that stuff that's in that masterclass bundle for $450. Again, it doesn't replace, and it's not every peptide. We didn't talk about every peptide. But here it is: peptides, microbiome, orthopedics. We had Dr. Stephen Mata there for that. GHKU, resistant. Why are some people resistant to peptides? Body composition, legalities, all sorts of things. If you are just wanting extra, again, these are clinicians talking about their experience with peptides, and they all lay out their protocols. I loved it. They laid it out. You could follow what they're doing. Suzanne Fury, she's even got a book that's so great called Counterclockwise. She lays out her protocols there. But if you need help with that, now again, one other thing I want to throw in here, this is just free in the bundle, is our glutathione packet. I have it, but it's not on the store yet, everything. But what we do have is a presentation, a didactic presentation on glutathione. Again, you can learn it, your staff can learn it, relearn it, maybe some different spins on glutathione. It's from an anti-aging perspective with a glutathione patient handout, something, a take home that you can give to your patient. So I'm a huge fan of those. All of these come with that. education for your patients. If you go to the medmasters.org store, it's all valued, it's all priced there. If you add all this up, it's $1,005. But wanted to offer that to you at a huge discount today. This is that glutathione didactic. So that's a slide on just maximizing your IVs with stacking, like I said, these superpower treatments, and it, you know, saves you a ton of money. So here it is again. All of these things come in, we bundled them together for a different price. I can actually see what's on here. So it's $1,005, yes. But what we're offering now, just today, tomorrow, and Friday, is you can get all of this for $425. If you want one of them, go to the store and buy it separately. If you just want to do one at a time, you can totally go buy it separately. Nobody's holding you to this. But for today and for the next 2 days, I've bundled them all together. There is one product on our store that has all of these for $425. That's cheaper than just the masterclass on peptides. Vicky's going to put this in the chat link right now so that you can click the button. We're going to send it out again to you tomorrow with a replay. It is going to go away Friday at midnight. I'm just giving this to the people here today because I want you to be able to standardize your medical practices, see what others are doing, have all the onboarding tools. The second you click that button, pay for it, there will be a little waiver. I want you to know that how you use these materials in your office is up to you. Without proper training, we don't support that. We also have hands-on options for everything, virtual hands-on or on-site options, but you sign a little waiver and then all the materials are going to get dumped into your inbox. You will have them as soon as you pay for this. You don't have to feel overwhelmed. You don't have to worry about how you're going to pay one of your staff to do this for you, or are you going to have to do it after you create customized treatment plans for all the, you know, patients you saw today. It's all there. So it's in the chat. While you think about that, I want to go into the chat and I want to answer or look at those questions that I've seen coming in as we've talked. First of all, I don't know if everybody can see this, but I wanted to see the thumbs up and thumbs down. If you think about your IV room, is anything I've talked about resonating? Is it something that you want to streamline in your office? How do you feel about collaboration to collect data that supports what we do? That says that even though this isn't standard of care conventionally, if we define standard of care a little bit differently, could it become something that without question has safety and efficacy profiles that get great results? So yeah, some thumbs up. That's great. I'm so proud of you. If you think of your IV room as a positive resource in your office and a benefit to you as a practitioner, then congratulations. If you're a little bit more nervous, there's lots of reasons for those apprehensions, and I appreciate you guys being vulnerable and sharing that. And I like this comment too, Dr. Henman. You can always improve. It doesn't matter how good you feel about it, you can always improve. Let's see the questions. What medical insurance covers MDs who use IV ozone? This is a great question. We get it all the time. I actually have, what should I do here? I actually have a list of insurance companies that we refer to. You'd have to email us and I could send it to you. One of us could send it to you. But it's not hard to get insurance coverage if you do ozone. It just costs you more. Sometimes double or triple. And I have that complaint a lot, and it depends on your scope of practice, depends on your state, depends on how your medical board defines it, depends on how you define it. Some people want to tell their malpractice everything that they're doing, every little detail to every IV therapy, and some say we're doing oxidative therapy in the IV room. So there's also that factor, is just how transparent you want to be. But if you email, I'm going to say email info@medmasters.org. and you're interested in that list, it's just a few providers. I know that they do coverage on ozone and peptides and human cellular tissue products if you want to get into biologics, but it will cost you more. And I have one client, not yet a client, actually. I run into him all the time. He loves ozone. I treated him as office manager at a conference, and it was like miraculous for both of them immediately. But he said, we went back, we were ready to buy everything, ready to implement it, and our malpractice was going to go up by 3 times. I was like, cool. Do you think that it's going to help 3 times, 3x, 3%, 30% of your patient base, do you think that your enthusiasm and your experience will be something you'll be able to share with them? You'll be able to charge them for that service, right? So you will make up the difference in what it costs you in insurance, but don't be alarmed that it does go up, and just everything's going up too. So it's not hard to get, but I can't think of all the companies off the top of my head. So just email us and we'll get that too. Okay, I knew this question was coming. Why high dose vitamin C the day before? And high dose is up for discussion. I follow the school of thought. Jason and I have conferred on this quite a bit, and just after talking and working with so many providers, that 20 grams is that line where it goes from antioxidant to oxidative. And it, according to Dr. Paul Anderson, which is also who I trained with and who he gave this presentation when we were with SOPMed, 20 grams is only oxidative for about an hour. So again, the term high dose, but it's more about, again, it donates electrons also. It's more about even, not more, but it's partially the hydration, right? The fluid and vitamins and the support that you're giving prior to the EBU. It's also phase 1 detox, vitamin C is. If you're doing a Myers cocktail with 20 grams vitamin C, B6 is part of the Krebs cycle. Like, you know, there's several minerals and nutrients that are required to get that, to jumpstart. It's like Poly MVA, his name is Al Sanchez, the owner over there, and we were talking about this the other day, and he's like, these things are like jump starting the battery in your car when it's dead. That's what it's doing for the mitochondria and the cell. And so you need those cofactors in getting the battery to work before you can jump start it with the ozone. So that's the reason for it ahead of time. And I can just tell you that is what those practices that have seen very few side effects, lots of great outcomes, faster outcomes, they're doing some sort of Myers variation. Could be the day before, could be a couple days before, but they're preparing their patient with it. All right, Teresa, so glad you're here, and thanks for all your questions. Do you have what to expect sheets for MAH and O3 UBI? Yes. I'm trying to remember if they're on our story yet or not, but we do. You're a member also. So email us and I'll get them to you. Remind me that I said that. Email us and I'll get them to you. We do have memberships. If you're a member, you get all this as the membership. It's $45 a month. It gives you so much stuff, and you get 20% off a lot of our other things. So that's why I say she's a member. Every time I add something, every time we come up with a protocol, every time we've got, you know, Jason's doing so much EBU, there might be more videos, etc. Anytime we add them, if you're a member, you just always have access. You always get it. And we're doing better at making sure you know that if you're a member. Thanks. I love patient education too. I'm telling you, it's a huge key. It's kind of the X factor, I think, in patient compliance, as well as are they going to be able to pay for it or want to pay for it. It's not about can people afford it. It's about do they want to afford it? Is this a focus that they have? Dr. Hinman, I was just thinking about you. Jason and I were talking about summer trips. And I know he had such a great time in Alaska. And I was like, I should have made it to Alaska this year. I should have come and visit you guys. Wendy emailed us the other day and I was like, made me think of you guys. So fond of you. Oh, yes. Okay. Procaine. Dr. Hinman is an anesthesiologist. We were all in the same room. What was that, May? I was with an anesthesiologist, same room, not virtually, last week. And we've got Dr. Suzanne Fury, who's not an anesthesiologist, but she's an MD. She's teaching Procaine. And I've been doing Procaine 15 years. I love the IVs, love the pushes. Even we had a practitioner, if you're on here, who had an adverse event, a female adverse event with EBU last week. He gave Procaine, which makes tons of sense. Procaine and magnesium. Procaine. But he's referring here, I don't know if you guys can all see this chat, but the stellate ganglion block. It's kind of new to me. Let's see, about 2 years now. Dr. Joel Baumgartner, I go to his conferences. He teaches it and talks about it. And then I met with Dr. John Hinman, who's like, we've been doing this forever. I met with that anesthesiologist last week, and he's like, oh yeah, we did it for regional pain syndrome when we couldn't define where it was at. And I'm not going to pretend to know, but it's using everything. Jason just had one the other day, and he said his was lidocaine, sometimes ropivacaine, procaine, but these stellate ganglion blocks. So I would love to, we're going to have Dr. Suzanne Fury. She felt impressed to teach it. So she's got a class in Georgia, like I mentioned, November 1st and 2nd. She's going to do all the didactics, and then she's going to have her day of hands-on. She's going to teach you how to do it. She uses procaine because, and you can tell me if I'm wrong, Dr. Hinman, but she says it's the safest, where she doesn't use ultrasound guided injections. To ignore the nervous system or cellular communication with any type of patient you have, including the healthy person who's just traveling all the time and can't sleep at night because she's so excited about all this information she gets to share with you today. It's stressful, right? Our nervous system is a little frazzled, and procaine is so magical. So thank you again, Dr. Hinman, for mentioning that. Teresa, when you talk about standard of care, is it set by the practices that do this often? I'm going to tell you, some practices have created their standard of care, right? They're like, I think of Courtney Lawson. I didn't see you on here, but if you're on here, she's always on here. Just so good at being like, I see the value in all these therapies, stacking them together. I can pinpoint it to infection, to detoxing, to mitochondrial function. I think it's best if we do these. And so that's what she does. Like when she offers EBU, she says you need all these other things too. And so certain practices have written this as standard of care. Then there's MedMasters experience that after we interviewed many, again, I kind of think it's a little bit of a gift, if I'm able to say that I have, I learned it working with practitioners. I was in the IV room 24/7 at one point, I intimately worked with 7 doctors or so. And there was always customized, every IV, every treatment, every patient, every condition. And I started to realize, whether it was IVs or supplements or diet or whatever, that there were patterns. After working with somebody for 6 months, I could be like, you know, that when you see this type of a patient, like 9 times out of 10, this is what we're doing. Can we just write this down? Can we just make this? Can we just like standardize this? Or I would come at it and say, is there anybody that wouldn't benefit from ozone? Is there anybody that wouldn't benefit from ethylene blue? And the people who shouldn't have it is far shorter than the people that should. So this becomes something that's like, so can I tell most people that they should do glutathione and why? The doctors would always say yes. I'm like, great, can we standardize this? So I feel like it's just a benefit, that an opportunity that we have of meeting with a lot of people to then extract what they say. I can't say everybody's got this all written down. That's why it's like, we wrote it down. We took it, we wrote it down, we created it, we standardized it, and I wanted to provide it to you. So it's a good question. But a real dream of mine is if we had 50 practitioners doing all the same thing for all the same patients, whatever that means, we could then say simple things like, if we could have a database that dumped into, and I'm pontificating now about my dream world, but we could have a database that says, if a patient comes in with pain levels at a 9 out of 10, and we do this protocol, whatever that is, for 6 weeks, then 40% of those patients had a reduction in pain by 30%. Like, we could really make this simple and collect so much information that would allow us to move it forward in that way. So it's not that everybody's doing it, but if we look at the common denominators, basically, right, what those patterns are, then that's where this information came from. Good question on pharmacies for peptides, new BioAge. And I just got I had a colleague who just got notification 2 days ago, Monday, that tirzepatide is all of a sudden like not as accessible. Got to buy it while you can in the next 10 days or so. Yes, there are other pharmacies. I like Pure Pharmacy, Hollandale Pharmacy. There are others besides New BioAge. I like New BioAge because they teach. Frank over there and Leonard over there, I love their platform. I love the way that they approach helping practitioners, but they're not licensed in every state and they don't have access to everything. I do love them for methylene blue, but I'm not up to date on all the pharmacies, all the states they're licensed in, and so on and so forth, but I do have a lot. So if you want to, Mary Lynn, email us also info@MedMasters. I have it all written down. Again, it's kind of in a resource tab that we have that we could get to you. Again, I'm not an expert on every state and all of that, but I could throw out some suggestions. Teresa, still perplexed. Who is collecting and publishing outcomes? They're not. That's kind of my my insinuation, my suggestion here, is let's find a way to do that. There is nobody publishing outcomes. I can't even, there's not a lot of practitioners who even standardize their protocol to say this works 20% of the time in this type of situation. This is why I think our obligation is to do better at this. All right, Vicky put in the link, the onboarding bundle, the methylene blue bundle. Denise, we were told we would have access to Ozone UBI Video Vault when I trained in Dallas 2 years ago, but the videos are no longer available. If you're not familiar with the transition from the separation from SOPMed and O3UV, it was dictated by law. We had to separate. We had to lose things. We lost a whole lot of things, not just access to vaults and stuff. We had to redo all the materials. It's not because they lied to you or intended to not give that to you once you purchased your equipment. It just had to change. So, yes, O3UV is still focused on not so much, and we don't work for them, but we do work with them still. We do have conversations, obviously, a huge fan, and we all work, Jason, Vic, and I worked with them for 5 years. So my understanding is they are working on FDA approval or certification for UBI. I don't think anybody thinks Ozone is going to go through, but UBI and the disposables, right? Certified facilities, all that stuff to get more approved. It's a very noble cause. It's going to take a while. But there had to be a separation between the equipment company and the medical information. So that's where MedMasters came from. We are offering those free vault materials. Again, after interviewing so many people, it's like, it's just amazing how many variations of procedures there are. How many people don't fully understand how to calculate a dose of ozone, even how to calculate a dose of heparin. We saw people like Mickey Mousing, their procedures together because they just couldn't get it to work. And some of the limitation was, well, if we have to pay for it, we'd rather just figure it out ourselves. We don't want that to be the case. That is where we get in trouble. So we do have those fundamentals that we can offer to you. Again, it's the didactics and it is the studies and research that was collected, and then the demonstration videos. We also now have certification and recertification programs online. We really, really suggest you do that. Not because we're in the business of doing it, but because we witness how these things go wrong if you don't properly train and follow protocols. So even if you need to do it virtually with probably Jason at this point, which he's great at all of these procedures, we made it really low cost to get your current staff recertified, because you'll be amazed at how they change things and they don't understand what they're changing. And it taints the medicine. It creates problems. Even if we're not standardizing it, if we're doing things incorrectly, that's even more dangerous. So at least we want you to be safe. So we've got the certification and recertification. There's a tab now on our website. That's something new that we put in there. We've made it very as cheap as we can make it, to pay for our cost, to pay for the trainer, to pay for the expertise. But we really encourage you to do that. That's also available at cost, but reasonable cost. The difference between the way that the FDA looks at this is that we are not the equipment company. Any medical device company, I was talking to Wendy and John about this a couple of months ago, is any medical device company or pharmaceutical, etc., they can make claims about what the drug or the equipment can do if it's FDA approved to do that, right? You guys know this, even if you use like low-dose naltrexone for off-label use, you as providers are allowed to practice medicine however you see fit based on research. If you can support why you do it, how you do it, the standard of care still needs to be there, but you guys are allowed to make that decision as providers. A medical equipment company cannot do that. As a A pharmaceutical company, a drug rep can't come to your door and say, here's how you use low dose naltrexone off label. They can't do that. You can make that choice, but they can't. So as a medical equipment manufacturer, they're limited in how they advise and share information with a medical provider based on what they're approved for. And we all know that it might take years and bazillions of dollars to get some of these things through that process. But we as an independent company either bring in providers to share First Amendment right personal experience, and all I'm doing is sharing with you what providers are doing, and I wrote it down and I'm creating it for you and making it easy for you. But again, that's where your responsibility still comes in. How you practice medicine, how you train your staff, how your informed consents go, that is still up to you, and you will be the one held responsible first. But that's hopefully how this has all been separated so that this stuff won't be taken down or removed the same way. All right, you guys, we're over in time. I'm happy to keep going, happy to answer questions. And please keep writing them in there if you need to. The code or the link, hopefully it's in here somewhere. Vicky, were we able to get the link for everything? Yeah, again, if you want to get each of these things individually, they're in the chat. You can go into the, you just want methylene blue, you just want EBU, you just want peptides, you just want a couple tools on glutathione. Procaine's my next project. There's stuff that we've got all things ozone. There's all this stuff there. You want anything individually. If we bundled it together, you still get it cheaper than individually. But if you just want the EBU handout, you can go buy it. But the things I talked about today, just for the next 48 hours, it's going to be that 425. And then it'll be removed. It'll just be taken down. You won't have access to it. But that should be on the store. Power in numbers. I love that. I like your idea. It would be great to have a Facebook group for your practitioners to share experiences. So we've thought about that. Jason's been a big driver of that concept. And so what we're kind of doing and changing is, instead of the eBoo mastermind, if you're not an eBoo provider, you haven't been invited to that, but we've had a collaboration of masterminds doing eBoo to help us with this. Give us feedback. Share with us the things that aren't working, the great successes you're having. How are you charging for this? How have you written your consent forms? We have been doing that for a couple years now. But we're going to kind of go back to that as a community resource for you guys to come in and share, collaborate, study together, become this alliance of practitioners. It's still going to be that same link, same, final Wednesday of every month, but we're going to have it on anybody can join. So not just eBill, but if you would like to come in, even like I have questions about EBU, I'm thinking about EBU, I want to talk to some other EBU providers, you could come and join that last Wednesday of the month for this community and collaboration. Facebook has its limitations. You have to be very careful about what you do and how you do it when it comes to medicine. So we're looking at other platforms that cost money. We're always trying to consider how much we're asking people to spend. They cost money. They take a lot of time to front load and to maintain. So you guys, when we have it available in real full force, it will be an expense, but I think it's an invaluable expense. This is where we could start to put together what these build out of protocols should look like and start to share the results, right? I'm working on that, a place to have a database or a place to dump the database to say, because this is what we're doing. All of our guests, they just share their personal experiences, right? You guys get to do that. What is the protocol you use? What types of things do you see from it? But what if we could pull all that together? So we have it in Zoom form. Come in and share it, collaborate. Jason will be there um, to kind of not monetize, what's the word? Moderate just open up the Zoom, allow everybody to speak freely and to talk there. But that's our first phase of creating that community. Then we'll get into figuring out which platform is the safest, the easiest, and spending the time to get in and front load all that. All right, you guys. Thank you so much for allowing us to be a part of your practices. We have so many great relationships. We appreciate your feedback. We appreciate your support and just and even would love to get your more feedback. What are you looking for? Because we have, again, we're in the position and opportunity to collaborate with a lot of providers. So what is it that would do the that we could do that would serve your practice the best? Um, and we'll work to do it. We'll work to create it. Again, nothing's free. Most things aren't free. We have to follow our own elements of legalities and entities and so on and so forth. And sometimes that's has sucked for us. But tell us what you need, tell us what you want, tell us what you'd like to hear, tell us what you'd like to learn, and we'll do it. We'll find ways. So again, thanks for being here. I hope that was helpful, that it was so insightful to talk to many of you, many of practitioners to find out what is doing the best these days and to think about creating standard of care, even though it can be frustrating. It's a lot of paperwork. It's a lot of, secretarial work that keeps you away from actual patient care. But I hope this helped you kind of see the value in that and also helped provide. So again, you could have this rocking and rolling on Monday if you got into this. So again, you guys, thanks. Enjoy the rest of your week, and we'll be sending out more information. You'll get this recording tomorrow. That link will be available till Friday at midnight, and then I promise you it'll disappear. I may never put that offer out again, but want to get these materials too.